Heart disease. Heart disease remains the leading cause of death for people over 60, and the risk increases dramatically with age. As we get older, our arteries naturally become stiffer and narrower, making it harder for blood to flow efficiently. Plaque builds up on artery walls over decades, and by age 60, this accumulation can become life-threatening. The scary part is that heart disease often develops silently. You might feel fine for years while your arteries are gradually closing. Many people don't realize they have a problem until they experience chest pain, shortness of breath, or worse, a heart attack. After 60, the heart muscle itself becomes less efficient, pumping with less force than it did in younger years. Risk factors compound over time. If you've spent decades with high blood pressure, high cholesterol, or as a smoker, the damage accumulates. Diabetes accelerates artery damage significantly. The good news is that it's never too late to make changes. Regular exercise, even just walking 30 minutes a day, can strengthen your heart. A Mediterranean-style diet rich in vegetables, fish, and olive oil helps reduce inflammation. Managing stress and getting quality sleep are equally important. Regular checkups become crucial after 60. Blood pressure monitoring, cholesterol tests, and EKGs can catch problems early when they're still manageable. Many people over 60 benefit from daily low-dose aspirin or statins, but these should only be taken under doctor's supervision.
Stroke. Strokes are the fifth leading cause of death and a major cause of serious disability in people over 60. A stroke occurs when blood flow to part of the brain is interrupted, either by a clot blocking an artery or by a blood vessel rupturing. Brain cells begin dieting within minutes, and the damage can be permanent. The risk of stroke doubles every decade after age 55. This happens because aging affects blood vessels throughout the body, including those in the brain. High blood pressure, which affects about 2/3 of people over 60, is the single biggest risk factor. Atrial fibrillation, an irregular heartbeat that becomes more common with age, dramatically increases stroke risk because it allows blood clots to form in the heart. What makes strokes particularly devastating is how suddenly they strike. One moment you're fine, the next you can't speak, can't move one side of your body, or can't see properly. Time is brain. Every minute counts. The acronym FAST helps recognize stroke symptoms: face drooping, arm weakness, speech difficulty, time to call 911. Prevention focuses on managing risk factors. Controlling blood pressure is critical. It should ideally be below 120/80. If you have atrial fibrillation, blood thinners can prevent clot formation. Controlling diabetes, maintaining healthy cholesterol levels, and not smoking all reduce risk significantly. Even after 60, lifestyle changes make a real difference. Physical activity improves circulation, and a diet low in salt and saturated fat helps protect blood vessels.
Chronic obstructive pulmonary disease. COPD is a progressive lung disease that makes breathing increasingly difficult, and it's the fourth leading cause of death in people over 60. This disease includes chronic bronchitis and emphysema, both of which damage the lungs over time. The primary cause is smoking, but decades of exposure to air pollution, chemical fumes, or dust can also contribute. What makes COPD so insidious is that it develops slowly over many years. By the time most people are diagnosed, they've already lost significant lung function. Early symptoms, a persistent cough, mucus production, and mild shortness of breath, are often dismissed as normal aging or smoker's cough. By age 60, if you've been a smoker, the damage may be extensive. The disease is progressive and irreversible. Your lungs can't heal the damage that's been done. Simple activities like climbing stairs, carrying groceries, or even showering can leave you gasping for air. In advanced stages,
Patients need supplemental oxygen just to function. The constant struggle to breathe is exhausting and severely impacts quality of life. The single most important thing you can do is stop smoking. Even at 60, quitting helps slow the disease's progression. Pulmonary rehabilitation programs teach breathing techniques and exercises that help maximize remaining lung function. Medications called bronchodilators can open airways and make breathing easier. Avoiding lung irritants like secondhand smoke, air pollution, and strong chemical fumes is essential. Getting vaccinated against flu and pneumonia is critical because respiratory infections can be life-threatening for people with COPD.
Alzheimer's disease and dementia. Alzheimer's disease and other forms of dementia are among the most feared conditions of aging, and the risk increases dramatically after 60. About 1 in 9 people over 65 has Alzheimer's, and that number rises to nearly 1 in 3 by age 85. This isn't just normal forgetfulness, it's a progressive brain disease that destroys memory, thinking skills, and eventually the ability to carry out simple tasks. The disease begins quietly, often with mild memory lapses that seem like normal aging. You forget where you put your keys, struggle to remember a word, or lose track of dates. But Alzheimer's is relentless. Over time, the confusion deepens. People get lost in familiar places, repeat questions over and over, and struggle to recognize family members. Personality changes occur. Someone who was gentle becomes aggressive, or an outgoing person becomes withdrawn. What's happening in the brain is devastating. Abnormal protein deposits called plaques and tangles build up, killing brain cells and disrupting communication between neurons. The brain actually shrinks as cells die. Currently, there's no cure, and treatments can only modestly slow progression in some people. Risk factors include genetics. Having a parent or sibling with Alzheimer's increases your risk, but lifestyle matters too. High blood pressure, diabetes, obesity, and lack of physical activity all increase risk. Social isolation and depression are also linked to higher dementia rates. Protection strategies focus on keeping your brain active and healthy. Regular physical exercise increases blood flow to the brain. Mental stimulation through reading, puzzles, learning new skills, and social engagement helps build cognitive reserve. Managing cardiovascular risk factors, blood pressure, cholesterol, blood sugar, protects brain health. Quality sleep is crucial because the brain clears toxic proteins during deep sleep. A diet rich in vegetables, fish, and healthy fats supports brain function. Cancer. Cancer risk increases significantly with age, and more than 60% of all cancers are diagnosed in people over 60. The longer we live, the more time cells have to accumulate genetic mutations that can lead to cancer. Our immune system also becomes less effective at detecting and destroying abnormal cells as we age. The most common cancers in people over 60 include lung, colorectal, breast, prostate, and pancreatic cancers. Many of these develop silently without obvious symptoms until they're advanced. A persistent cough might be dismissed as allergies when it's actually lung cancer. Fatigue and weight loss might seem like normal aging when they're signs of something serious. What makes cancer particularly dangerous after 60 is that treatment becomes more complicated. Older bodies may not tolerate aggressive chemotherapy or radiation as well as younger ones. Other health conditions can limit treatment options. Recovery from surgery takes longer. However, early detection dramatically improves outcomes. Regular screening is crucial. Colonoscopies for colorectal cancer, mammograms for breast cancer, low-dose CT scans for lung cancer in former smokers, and PSA tests for prostate cancer.
These screenings can catch cancer in early stages when it's most treatable. Prevention strategies include not smoking, limiting alcohol consumption, maintaining a healthy weight, and staying physically active. A diet rich in fruits, vegetables, and whole grains, while limiting processed meats and red meat, reduces cancer risk. Protecting skin from excessive sun exposure prevents skin cancer. Getting recommended vaccines like HPV and hepatitis B also helps prevent certain cancers.
Diabetes. Type 2 diabetes becomes increasingly common after 60, affecting about 1 in 4 people over 65. This disease occurs when your body can't properly use insulin, causing blood sugar levels to rise dangerously high. Over decades, excess sugar in the bloodstream damages blood vessels and nerves throughout the body. The frightening aspect of diabetes is its complications. It's a leading cause of kidney failure, blindness, heart disease, stroke, and amputations. High blood sugar damages the tiny blood vessels in your eyes, potentially causing vision loss. It damages nerves in your feet, leading to numbness where you can't feel injuries that become infected. It accelerates artery disease, increasing heart attack and stroke risk. Many people over 60 have pre-diabetes without knowing it. Blood sugar is elevated but not yet diabetic. This is a critical window for prevention. Without changes, pre-diabetes typically progresses to full diabetes within a few years. Risk factors include being overweight, especially carrying excess weight around the abdomen, lack of physical activity, and family history. Certain ethnic groups, African Americans, Hispanics, Native Americans, and Asian Americans have higher risk. Prevention and management focus on lifestyle. Losing even 5 to 10% of body weight can dramatically improve blood sugar control. Regular physical activity helps your body use insulin more effectively. A diet low in refined carbohydrates and sugars, focusing on vegetables, lean proteins, and whole grains, keeps blood sugar stable. If lifestyle changes aren't enough, medications like metformin can help control blood sugar. Regular monitoring is essential. Check your blood sugar levels, have your A1C tested every few months, and get annual eye exams and foot checks. Controlling blood pressure and cholesterol is equally important for preventing complications.
Kidney disease. Chronic kidney disease often develops silently over years and becomes more common after 60. Your kidneys filter waste and excess fluid from your blood, but aging, diabetes, and high blood pressure can damage these vital organs. About 1 in 3 people over 65 has some degree of kidney disease, though many don't know it. The danger is that kidney disease typically causes no symptoms until it's advanced. Your kidneys can lose up to 90% of their function before you feel sick. By then, you might need dialysis or a kidney transplant to survive. Early stages show up only in blood and urine tests. Elevated creatinine levels and protein in urine are warning signs. Risk factors include diabetes and high blood pressure, which are the 2 leading causes of kidney failure. Prolonged use of certain medications, particularly NSAIDs like ibuprofen, can damage kidneys. Heart disease, obesity, and smoking also increase risk. Once kidneys are damaged, the decline can accelerate. Waste products build up in your blood, causing fatigue, nausea, confusion, and swelling. Severe kidney disease affects every organ system. It causes anemia, weakens bones, and increases heart disease risk. Protection starts with managing underlying conditions. Controlling blood sugar and blood pressure is crucial. Regular kidney function tests catch problems early. Staying well hydrated helps kidneys function properly. Limiting salt intake and avoiding excessive protein protects kidney function. Be cautious with over-the-counter pain medications.
Use them sparingly and only when necessary.
Osteoporosis. Osteoporosis is a silent disease that weakens bones, making them fragile and prone to fractures. After 60, especially for women after menopause, bone loss accelerates dramatically. About half of women and 1 in 4 men over 50 will break a bone due to osteoporosis. What makes this disease so dangerous is that it's completely silent until a bone breaks. You can't feel your bones weakening. Many people discover they have osteoporosis only after a minor fall results in a broken hip, spine, or wrist. Hip fractures are particularly devastating for older adults. About 20% of people who break a hip die within a year, often from complications of immobility. Bones are living tissue that constantly break down and rebuild. As we age, breakdown outpaces rebuilding. Women lose bone density rapidly after menopause due to declining estrogen. Men's bone loss is more gradual but still significant. Risk factors include family history, being thin or small-framed, smoking, excessive alcohol consumption, and lack of calcium and vitamin D. Prevention is critical because once bones are severely weakened, treatment can only slow further loss, not fully restore strength. Weight-bearing exercises like walking, dancing, or lifting weights stimulate bone formation. Adequate calcium intake from dairy, leafy greens, or supplements provides building blocks for bones. Vitamin D, which helps absorb calcium, is equally important. Most people over 60 need supplements because skin becomes less efficient at producing vitamin D from sunlight. Bone density scans after age 65 for women and 70 for men can detect osteoporosis before fractures occur. If bone density is low, medications called bisphosphonates can strengthen bones. Fall prevention becomes crucial. Remove tripping hazards at home, use good lighting, and wear supportive shoes.